Hello, I'm Dr. John Babu, surgical oncologist, robotic surgeon at Fortis Hiranandani, Vashi, Navi Mumbai. Today, we'll be speaking on breast cancer, one of the most common cancers in the ladies, especially in our country in India. Most of the cancers in our country are found among the younger women. In the West, the demographics is a little different. Breast cancer is more in the elderly ladies. Breast cancer in India is more genetic. Breast cancer in the West is more related to the lifestyle. We'll be discussing breast cancer in 4 different parts. The first part will be related to the etiology, the causes of breast cancer. The second will be the screening and the diagnostic tests. The third will be the staging of breast cancer. And fourth will be the treatment modalities. So coming to the etiology or the causes of breast cancer, no one factor has been directly associated with breast cancer other than the genetic causes. Patients having a strong family history with mother, sister, grandmother, mother, sister having breast or ovarian cancer should be screened for breast cancer. The other causes generally given are very theoretical and not practical. They are patients who are unmarried having no issues, patients having a late menopause, an early menopause and a late menarche. These are mainly related to the hormonal imbalances that the lady faces. The other causes of breast cancer are generally mentioned in the newspapers, articles and WhatsApp forwards, like use of deodorants, perfumes, are generally not related to breast cancer and they have no such direct causative agent. The second part is the screening and the diagnosis. Screening for breast cancer is very simple. It's a simple mammogram after the age of 40. For the younger ladies, a sonography of the breast can be done. The diagnostic tests for breast cancer, once you detect a lump in the breast, are generally mammogram, a biopsy. It could be a USG guided biopsy or a true cut direct biopsy by the physician, a good clinical examination by the treating physician or the treating surgeon. If it's an early breast cancer, a simple sonography of the abdomen and a chest X-ray will do. But if it's a locally advanced breast cancer, if it's a large tumor, we generally go for a PET scan as well, or a whole body scan using a simple CT scan of the thoracic cavity, the chest and the abdominal cavity. Once the diagnosis is certain, we know the staging. We divide the breast cancer generally into 3 parts, which is an early breast cancer, a locally advanced breast cancer, and third being a metastatic breast cancer where the tumor has already spread. Early breast cancers are tumors which are less than 5 centimeters in size and do not have any axillary lymphadenopathy. The locally advanced breast cancers are generally tumors that are larger than 5 centimeters, involving the chest wall or the skin with axillary lymphadenopathy. Metastatic cancers are the ones that have spread to the lung, to the liver, to the bones, etc. Once we are almost certain about the stages of the breast cancer, the treatment depends on the stage. Early breast cancers are 100% curable. There's really nothing to fear about. And the treatment modalities generally include surgery, chemotherapy with plus minus radiation. Locally advanced breast cancers generally require chemotherapy to begin with. This is followed by surgery. This is followed again with a dose of chemotherapy and then added radiotherapy as well. Metastatic cancers are generally dealt with chemotherapy alone. In breast cancer especially, there are hormonal tablets that will depend upon the biopsy. There are multiple parameters that we see in a biopsy report. One of them is the hormonal status of the biopsy, the ER and the PR, which are the estrogen and the progesterone receptors. If they are positive, hormonal tablets are given after the treatment is completed for the next 10 years. This, in short, is the entire purview of breast cancer. Please meet your physician as soon as possible. Thank you.